Good afternoon, everyone. Welcome back to the NCHB 2020 Annual Conference Virtual Edition. My name is Cindy Borden, and I am your moderator for today's session, using a racial equity lens to serve all who served. We're really excited about this session and our panelists. This is a really important topic, and as many of you know who've been on some of the other sessions over the last week and a half, racial equity has come up in many different forms, so we're really excited. This is an important topic for us. Just a couple of housekeeping things before I introduce our panelists for today. As you should know by now, if you've been at the other sessions, all of you have entered the webinar muted, but we do want to hear from you. We want to hear your questions, so please submit those through the question box in the GoToWebinar platform. With that, I would like to introduce both of our speakers for today. First, we have Chandra Crawford. Chandra is the Director of Individual Homeless Adults for the National Association, for NEH. I'm totally tripping over my words today. For the National Alliance to End Homelessness. There we go. I apologize for that. With a focus on racial equity. She previously served in the Program and Policy Analyst role at the Alliance, and prior to being at the Alliance, she worked at Gilead Sciences and developed an evidence-based HIV screening initiative in 2 southern states that were heavily impacted by that epidemic. Chandra also served as the Policy Director at Unity of Greater New Orleans, the HUD-designated COC, where she successfully led an initiative to secure 3,000 permanent supported housing vouchers from Congress for poor and disabled residents in the state of Louisiana. In that role, she was also instrumental in the creation of a statewide office designated to coordinate homeless services and the reestablishment of the Louisiana Interagency Council on Homelessness. Chandra is proud to note that her first legislative victory was the enactment of a 5-year pilot needle exchange program in the state of Delaware, while she was the policy coordinator at the Delaware HIV Consortium. She earned her PhD in public policy from Purdue University, and we're thrilled to have Sean here and all of her expertise. After Sean speaks, then we're going to hear from Dawn Gilman, who is the CEO for Changing Homelessness. And she joined Changing Homelessness in 2007, but she served as the CEO since 2009. And under her leadership, Changing Homelessness has grown from a single employee into an agency that employs more than 35 staff members. And it's increased both capacity and funding to end homelessness in Northeast Florida. The agency currently has a $6.4 million budget with approximately $4 million as pass-throughs to subgrantees. And that funding provides housing, case management, prevention, and other supportive services to end homelessness. The community has seen an 80% decrease in veteran homelessness, 57% in chronic homelessness, and a 30% decrease in overall homelessness from 2009 to 2018. So as you can see, we have 2 great speakers here today. So I am going to pass things over to Sean to get us started.
Okay, great. Thank you, Cindy. I appreciate the introduction and the invitation to speak today. Okay, so as you all know, I'm Shawn Crawford from the National Alliance to End Homelessness. And for those of you not familiar, you can go to the next slide, Cindy. For those of you not familiar with the Alliance, it's a nonprofit, nonpartisan organization committed to ending and preventing homelessness. So to learn more, you can check out the rest of the slide later or visit us at naeh.org. So let's begin the presentation, a very important topic today, right? So today I'm going to start with a quick overview to put the purpose of our conversation about racism in the call to action in context. I'll then talk about COVID-19 and structural racism, and then move into a discussion about homelessness and veterans experiencing homelessness. So the remaining presentation will focus on what the homelessness system can do to address racial equity. Next slide, please. So, as you all know, there's a lot of talk about racism these days, right? You can go to the next slide. And so certainly the racial and ethnic disparities we've seen with the COVID-19 pandemic and the murders like that of Mr. George, and not to mention the news that we've gotten about Breonna Taylor today, they sparked national discussions, right? So let me say this. So it's obviously a good thing that more people are beginning to recognize racism and the impacts of structural racism. But I want to dig a little deeper on this subject because I keep hearing things like, and you can go to the next slide, if ever there were a time, right? So while I agree deeply that we should take this opportunity to invoke change, I want to be very clear. What we're seeing now is actually, unfortunately, nothing new. So that's why I kind of devised this little chart down that you're looking at now. So if you look at some of the factors, and we'll talk more about these pandemics in greater detail shortly. So looking at these pandemics, you look at the factors of, for example, Black overrepresentation in homelessness, which has been around, nothing new, and the disparities we see with COVID-19. They overlap. And so, you always see these types of terms, inadequate access to health care. And so let's drill down a bit because this is really important to this conversation so that we have some understanding and we're not just throwing words out. So a lot of times of what we hear and again, we're talking about COVID-19 and the overrepresentation of homelessness. So let's tackle healthcare. So oftentimes we think of minority groups are less likely to have health care. Black and brown people lack insurance, true. And then we hear things about Black people in particular being distrustful of the medical institution because of unfortunate experiments such as Tuskegee, true. But one thing that you don't hear a lot about, and that is the distrust of the medical establishment of Black and brown people. So even if you have access to care, does not mean that you have quality of care. And this just isn't me talking, okay? So there have been countless studies that show that providers are less likely to prescribe certain things to people of color because they feel like they won't adhere. There's a recent study that shows that there's bias and stereotyping when it comes to Black pain. So I just want to drill down because we talk about how do these disparities occur, and we always throw out these terms. So I want you to understand things like when we talk about healthcare, we're talking about the lack of insurance. Yes, there are some terrible things that have happened, but then also the people that are supposed to provide us care, they're just like you and I, and they have biases. And yes, that does impact people of color, okay? So I just kind of want to start to really talk about these things. And so when I say things like structural racism, how things occur, we kind of have a sense, right? And I could have even developed a similar chart from Mr. Floyd and homelessness. So in sum, what I really want to say is that people should be aghast by recent events, but I want people to know this has been an ongoing problem and to recognize, quite frankly, some of our own complacency, right? So secondly, I really want people to understand, and you can go to the next page, is that if we fail to address structural racism, we will always land in the same place and racial disparities will continue to persist. And so I wrote things like Hurricane Katrina, homelessness, overcriminalization, COVID-19, and so on. So stay with me for a second. This story is related. So the reason why I'm here on this field is actually because of Hurricane Katrina. So I watched the devastation unfold from the East Coast, and I was horrified by what I saw in terms of who was left at the Superdome, what communities received little assistance, and so on. So I saw myself in the Black people who expressed abandonment in New Orleans. And so I decided that once policy positions became available, that I would move there and try to help. And at the time, Katrina had exposed existing socioeconomic inequities, and people were angry. And then eventually, most of that anger faded. Do you even really hear about Katrina that often if you're not in the area? And so although inequities still exist there, those haven't faded. And so we see his face again, right, with COVID-19 and how it's impacted Black people in the city. And it's like we've come full circle again. And that's why in caps, to start this slide, I say racial justice requires a movement. It's not a fad. This is work for the long haul. So don't be aghast one moment and then complacent on the next. Okay, so let's move to the next slide. So let's talk about COVID-19, okay? And so we know the COVID-19 pandemic is not affecting all communities the same way. And so we really, again, cannot talk about this crisis without addressing structural racism. And so at the beginning of this pandemic, when states began to report demographics, Black people were overwhelmingly disproportionately impacted. And we saw disparities among other minorities too. Let me be very loud and clear about that. But at the onset, Black people were the most glaring. So I'll largely talk about Black people today, more or less as an example. So let's demonstrate this point. So we know Black people account for 13.4% of the general population. And an early study reported that, and remember I talked about at the onset, that the counties with higher Black populations, they accounted for more than half of all cases and almost 60% of deaths. And so basically the likelihood of COVID-19 increased with the proportion of Black residents, according to an AFAR study. And I can't think of the tracking site right now. It escapes me. But at any rate, the 5 highest counties with the largest deaths due to COVID-19, 3 of those are highly populated by Black people. Okay, Cindy, go to the next slide. So just some more numbers so we get what's happening here. So Black people are also 2 times more likely to die from COVID-19 than white people. That's the highest statistics. You can go to the next slide. Black people are almost 5 times more likely to be hospitalized than white. So they're actually at about 4.7 times more likely. And actually, in terms of hospitalization, Indigenous groups are at 5 times, and Latinx groups are 4 times as likely. So let's talk a little bit again about why this is. And remember, I gave you some knowledge. I kicked some knowledge out, and that's a good slide. You can leave it right there, Cindy, about some of the healthcare stuff, right? So we know that due to practices like redlining and discriminatory housing practices, that in general, Black people are less likely to live in neighborhoods where healthy foods are readily available. See the connection with diabetes, obesity? I've already given you that connection to healthcare. Even though you may have access, you might not receive quality, are more likely to live in substandard housing, and I mentioned have less access to healthcare, just to name a few. So in sum, for those who might not understand, or if you haven't understood the connection here, COVID-19 poses a higher risk to Black people because of underlying health, social, and economic disparities rooted in historical and structural racism. And another very important thing to keep in mind is that Black and brown people are less likely to hold jobs that allow them to work from home. So to stay at home and shelter in place, that is a privilege. Now let me say this about all these numbers I just gave you. We might not know necessarily the housing status of all the people in these reports, but we are certainly aware of the disparities that exist in the homelessness system, and we'll talk about that in a minute. So when you put the medical vulnerabilities that disproportionately affect Black people together with their overrepresentation in the homelessness system, you can see how this pandemic could be particularly catastrophic for this group and why we would want to have this type of discussion today. Okay, Cindy, next slide. So now let's look specifically at the homelessness system, okay? So again, the most striking disproportionality can be found among African Americans, and so we know, I said it already, that African Americans make up about 13% of the general population, and yet they make up about 40% of the homeless population. So Cindy, you can go to the next slide. And I always like to use this slide because, see, if you look at the little chart and you look at Black or African American, you see the number, like I said, 13% of the U.S. population. And then you see that number, 23% poverty, right? And then you see 40% homelessness. So that, I just want to emphasize that poverty alone does not account for the disproportionality that we're seeing. So let's go to the next slide. Just have some more examples. So it's really interesting. In every state, Black people are more likely than white people to experience homelessness. And I'll tell you why this is a shocker, because And no offense to places like Maine and Idaho, but I don't, they don't necessarily have a lot of big Black population, and even in those places, you see a disproportionality. So that shocked me. So you can go on to the next slide. So now, basically, we want to talk about veterans experiencing homelessness, and so I won't say too much about that because Dawn is going to give a great presentation breaking down her program. But the whole point of this is to show you that, yes, we see the same or similar disproportionality with veterans experiencing homelessness. And so I have the numbers laid out for you, but just to summarize that, for example, Black people make up about a third of vets experiencing homelessness, but only 12% of all vets. And so I kind of talked about, in the limited time that I could, that, the disproportionality in homelessness is influenced by historical and structural racism. And obviously those include feeder systems such as criminal justice. And we can and certainly should be involved in larger movements to promote racial equity. But what we want to make clear today, though, is that there are things the field can do to make sure the homelessness system itself is not having a disparate impact on people based on race and ethnicity. Oh, and you can turn the next slide, Cindy, because we're going to, there you go. And so the big question of today is, are there tangible things we can do or consider to promote equitable outcomes? And I really want to emphasize that because I get that all the time. Well, really, we have people coming into our system, and it's this system and that system. And sometimes people get so overwhelmed that we just want to emphasize, yes, and we have to figure out a way we have to look at our data and see what systems we're most affected by and form partnerships. But that doesn't let us off the hook, and that doesn't mean that inequity isn't happening in our system. And that is something we can do about today. So that's why we're here. Hopefully you will hear some helpful things today to help you get started or thinking more deeply about racial equity if you haven't already. So let me go through this rather quickly so our next speaker has a lot of time to talk. So let me give you some things to do here. So the first thing I would encourage is for you to look at HUD's tool. So it helps you look at racial disparities in your COC or in your area. So for instance, it allows you to look at distributions of race in your COC for all people living in poverty, people experiencing homelessness, and people experiencing unsheltered homelessness. So you have that overall view, right? And then let's go to the next slide. And so the second helpful tool, and again, this is just if you haven't got started. If you are looking at your data and you already know what to do, fabulous. But if you need help, here's a helpful tool. So the second tool is from my organization's Racial Equity Network, and it looks at simple data points, whether the outcomes in your system or programs vary depending on race or ethnicity. And it really looks at simple data points. Basically, who's in your system, who gets what in terms of emergency shelter, transitional housing, and permanent housing, and who returns. And so, Cindy, you can click to the next tablet. And so this is more or less, I have links to our site so you can see the tool and the strategic steps that I've talked about. So this is just to kind of give you an idea of how it looks. And Cindy, you can go to the next page. And we've also added a COVID-19 tab to our racial equity data tool. And you can see the data points, again, are very simple, but it gives you a sense of what's happening in your program. And then you can go to the next page. Again, I just put these slides in so that if you do want to go back and look at these tools, you just kind of have an idea. You can read through the slides of how they're laid out. But basically, what I really want to emphasize is that it's urgent to gather demographic data about who's contracting the virus, who's getting tested, and who's getting housed. Essentially, without racial data, we cannot see if there are disparities. You have no idea if you're not looking. And if we don't see disparities, then we probably don't factor them much in our approaches or our response. And I put in big red caps. Now what? right? Because let's say you've looked at your data and you found disparities. Well, we want you to keep going and use data to make changes. So the REN, in conjunction with the racial data tool, they also developed some action steps to help you think through some of these goals. We just don't want you looking at data and not moving on it. We want you to look at data and then develop strategies to promote equitable outcomes, right? That's the ultimate goal. So look, I'm just going to go through these steps really quick, and I want you to know that the strategic action steps are much more detailed than this. However, just for the length of time, I'm just going to go over a few very quick with you so you get the gist of it, but you can go back and look through it. So, for instance, I mentioned who experiences homelessness. If you find a disparity there, in most COCs, more than likely, you will. But add race ethnicity data to your COC reports for continual tracking. Who gets into crisis housing? If you notice a disparity, and you can go to the next slide, Cindy. If you notice a disparity in clients assessing shelter and transitional housing, convene a group of staff members and guests in the shelter, including community stakeholders, to review policy and procedures for barriers that might cause a specific racial group to avoid shelter. And then, so those were just two short-term steps, but there's a host of things that you can do. Like I said, I'm just kind of giving you a snapshot. Who gets into permanent housing? If the number of people assessing permanent housing is disproportionate. So as a long-term step, get technical assistance to redesign your coordinated entry processes. Who returns to homelessness? You can click to the next page. Another long-term step, explore other systems to engage, to connect people with mainstream resources to help maintain stability. So with the action steps, again, there's a combination of long-term, short-term. Again, this is just to kind of give you a taste of it, if you will. But it also is important to keep in mind that the action steps, they provide additional plans to consider whether you find disparities in your data or not. So this is going to be really quick. So there's some organizational things to consider. Designate a staff person or a team to address racial equity. Please commit some resources. This is a long-term process. Annually train staff. Hold ongoing opportunities to discuss racial equity. And most importantly, please listen to the people with lived expertise. Provide opportunities for those in your system to give feedback and expand opportunities for policy participation. Your data may say, oh, you're doing great, and then you talk to the people in your system, and then you find out, well, maybe you're not doing so great, and how do you rectify that? So there's a lot of work to do. So if you haven't started, look at the data tool if you need help, and if you have started, plan out your action steps and execute. Most importantly, make sure you're speaking to the people actually going through the system to analyze equity. Resources are available, so please use them if you need help thinking through this. And I'd like to end by just saying, let's be committed to change. Thank you.
Thank you so much, Sean. There was so much good information there, and we appreciate you trying to consolidate things. There are some questions coming in, so keep those coming in. We are going to turn things over to Dawn now to talk about what she's done in her organization around this. So, Dawn, it's over to you.
All right, thank you so much. As I was introduced, I am Dawn Gilman. I'm the CEO of Changing Homelessness. Just to orient you a little bit, Changing Homelessness is a COC lead agency. We cover 3 counties and the far northeast corner of Florida, which is Duval, Clay, and Nassau County. We are also an SSVF grantee in Northeast Florida and Southeast Georgia. So the data I am going to share is all from our COC, which is FL 510, or those 3 counties. So we are talking today, and I'm going to kind of go into a little, kind of tee off a lot of things that Sean talked about in the previous presentation. When we talk about race equity and ending homelessness, a lot of times there's huge sections of things that we can be talking about: housing policy, demographic shifts, cost of building, NIMBY, transportation, and the focus on how do we end homelessness. So my presentation is going to focus on the data, racial equity, and the ending homelessness pieces, really based in that small community that I am talking about. So we're going to look at issues and what structural racism and race equity is, then institution or system equity issues, and then go down to the program level. So understand, like almost everyone, we are at the beginning of this work. So I want to kind of orient how our thinking has evolved a little bit. So if you go to the next slide, what you are going to see, yep, that is Duval County or Jacksonville, Florida. And what this is showing you are our different health zones within the county. And that big red zone in the middle is Health Zone 1. So Health Zone 1 is the area in our region. It has the highest infant mortality rate, the highest HIV/AIDS rate, poverty rates, unemployment, and homelessness. Every community has a Health Zone 1 or its equivalent within the larger context. So what we also need to start thinking about is, what do these Health Zone 1s have in common across the different communities in the country? And one of the most common denominators is a history of redlining. So if you go to the next slide, what you're looking at is the current or modern day health zones, and then on the left is the 1937 redline map for Duval County. So what, if you are unfamiliar with the term redlining, it is the area of the community that was considered risky to lend capital for homes or businesses. In most communities today, the largest concentration of poverty and homelessness lines up almost perfectly to redline mapping from 80+ years ago. So what we are working on when we talk about structural racism is decisions that have been made often far in the past have consequences today because they have not fully been addressed and changed. So what are our responsibilities today in the work that we do? So if you want to go to the next slide, we're going to look at system demographics. So when we start looking at our system, we compare who is in our community to who is in our homeless community. And Sean talked about the different tools that you can use, and this is a version of those that shows you who is served within the homeless system of care. And it breaks it out by race and ethnicity. And as you can see, in Northeast Florida, we have about 66% of people who identify as white, and about 26% who identify as Black or African American. And again, I'm focusing on those two demographics because they are the largest two demographics within Northeast Florida, especially when you look at who ends up in the homeless system. It is overwhelmingly Black and it is overwhelmingly Hispanic. In Northeast Florida, we're very different than the rest of the Florida, that we have a fairly small Hispanic population. Yet if you look at who the ethnicity within our homeless system of care, it is a pretty extraordinary 52%. As Sean mentioned, all COCs have been required for the past 2 years to report out on racial, just to do a racial equities report to HUD. So this information should be available to you from your lead agency. They probably turned it in with their continuum of care application. And it is a good starting point to know where the entire system is. Most COCs look somewhat like this, and that we and the system we work in is on the receiving end of a very different group of people than the average person living in our communities. So next slide. When we're talking about changing equity, even more importantly as to who is, I'll call it, delivered into our system, is how do people exit, right? The only known cure to homelessness is a home. So one of the key things we have looked at is exits to permanent housing, also on racial and by racial and ethnic groups. And when you look at this, you start to see where are we doing well and where do we have a lot more work yet to do. Again, when you look at the difference on who is exiting, you will see it continues to skew more positive towards the white population who experiences homelessness versus African American. However, when you go all the way over on the Hispanic, which is an ethnicity, that is where we're starting to see some, I'll say, the needle is pointing more in the, or moving in the right direction with that. So again, this is everybody that goes into our system of care. This is a pull from our HMIS population. But here at this conference, we're specifically talking about veterans. So I am going to show you some more information specifically on the SSVF program within our continuum. So if you go to the next slide, again, the first thing we look at is who comes in. So if you look at this slide again, you're going to see for the SSVF program, specifically the rapid rehousing portion of it, it actually is a pretty good mirror, maybe even a little bit towards the positive side, that we are serving far more Blacks or African Americans, but it's pretty close to that overall demographic of who comes into our community. So if you want to go to the next slide. We also wanted to take a look at how are our other rapid rehousing programs doing in comparison to the one that's specifically for veterans. So that's what you're looking at here. Who is being screened into rapid rehousing, both the veteran rapid rehousing and all other. So again, we're doing pretty good on the veteran side. They're actually doing an even better job on the non-veteran side for screening in persons who are not white. So on the next slide, if you'll go there, this is where we start to look at those positive and negative exits. And this is where we start to see us on the veteran side that we're moving that needle in the right direction. If you look at positive exits versus negative exits, we're making that change happen, which means the SSVF program and the services it provides through case management and through housing search and housing assistance starts to change who gets into housing and is able to stay there. If you want to do one more slide, which is the last slide, this is a look at both SSVF and non-SSVF by positive and negative outcomes. So what it's telling me is the rapid rehousing programs in our continuum are actually moving the needle in the right direction. The overrepresented groups are exiting at a higher positive rate than how they flow into our system. And at least with the rapid rehousing intervention, we're starting to see progress, or that needle moving in the right direction. So just to kind of summarize where we're at, data doesn't end homelessness on its own, but it does show us where we need to focus our time and attention, right? On this data, it shows us something positive is happening within this particular intervention, and how do we replicate that in our emergency shelter and transitional housing and our permanent supportive housing programs. Similarly, demographic data won't end racism in our country, but it can start to tell us the story of what is working and where we need to focus. So with that, I am going to end and thank you all for your attention as we have been presenting. And I know there are questions coming into the question box. So with that, I will turn it back over to our moderators.
Thanks so much, Dawn. A lot of good questions coming in, and keep those coming in. We're going to start, and this is sort of a question, but sort of a comment, but I think it's important. And this goes back to some of Sean's remarks around COVID. And the question is, you know, COVID-19 affected the Black community a lot, and the testing sites in those communities was lacking, similar to the quality of healthcare. This person had to wait several weeks to get a COVID test, but when they went to a different neighborhood, got the results right away, was able to get the test and the results right away, and that neighborhood was a predominantly white neighborhood. And so the comment is sort of, why is this the case? It seems like nothing has changed and nothing is changing. I'm not sure if there's an answer there for either of you, but I felt like it was an important comment to raise.
So I'd like to just comment on that, because I think that is an incredibly important thing to think about. And it is important when you have partners that are willing to change that, to really support them and figure out how to make it work. So very similarly, at the beginning of the pandemic in Jacksonville, the only way you could get tested if you were not a first responder or an essential worker is you had to go through a drive-through test site. And we all know that people who are in poverty, which as Sean showed us tends to be people of color, are less likely to have the transportation and the time available to go through those drive-through test sites. We teamed up with our teaching hospital, UF Healthcare. They started doing pop-ups, walk-up test sites in neighborhoods of concern, those neighborhoods that I showed you on the red line map. And then they were willing to team up with the shelters in the area and do the same sort of walk-up testing. And we were able to do a big test, massive test at the beginning of this outbreak, which doesn't cure it, but at least you know what you're dealing with when you're working with people who are living in congregate living situations and on the streets.
Thank you, Dawn. The next one is a question. I'm wondering about the intersection in racial disparities in the legal system and homelessness. If people of color are disproportionately incarcerated and a legal history makes identifying housing more difficult, it would increase homelessness. One racist system seems to be adding to another.
Oh, Sean, you're
I
on.
think you're muted. Try one more time, Sean. There you go.
There we go. Right. So you are correct. And so, but and a lot of times when we talk about this, we do talk about criminalization. There are a host of systems, education and so forth. And just like the previous question, talking about access to testing and where the testing sites are and who are they really accessible for. So it's really important to work about that. But let me spin this into the data because I think it's really important. And I say that because I've gotten this comment so many times that people in the field, it's like, there are so many systems, right, that feed into our system. And so what do you do about the inflow? And I love using Connecticut as an example. And in this case, I am going to talk about criminalization with the recognition that there are a host of systems, right? So what they found in their data, and so I'm going to butcher the statistics, the numbers, because I don't exactly remember the exact figures. But at any rate, they looked at their data to see, okay, we see that there's a disproportionate number of Black and brown people in our system. Where are they coming from? They're tracking their data. Oh, we see of those Black and brown people, an overwhelming number of folks have come from the criminal justice system. And so that lets us know then where and we talk about those long-term strategies, where we need to direct some of our work and to form partnerships with. And so this, again, speaks to looking at your data and seeing knowing where people are coming from, and then trying to form those partnerships. But at the same time, I always like to give this example. When we first developed the racial equity tool, we just asked the community that they actually weren't doing any racial equity work per se to test the tool. And it was interesting because what they found, so in their community, I'm going to break it down pretty much Black and white, because the other ethnic minority groups, the numbers are really small, and it literally does break down to about 80-20. So they had about 80% of people in their system were African American, and then about 20% are white. And then when they did the tool, what they found is 80% of white folks actually got into the transitional housing, and only 20% of Blacks. And so it was totally reversed. So why am I saying that in connection to this question? Because the fact of the matter is the criminal justice system actually had absolutely no role in who got into that transitional housing. And so I don't want us to get into too caught up, because we do have to form those partnerships, we do have to track our data, and we do have to look at inflow. But at the same time, we also better talk about what's happening in our system, because it wasn't welfare, it wasn't criminal justice who made that decision or designed that program that 80% of whites will get into transitional housing, where you have 80% of the people in your system being African American. So that's what I would offer.
Thank you, Sean. So our next question is, how do we address the social and economic disparities of people of color with the current administration in the White House when racism is deeply embedded?
Don, you better take that one.
Okay.
You know, I said that I wasn't happy today. It was a
I'm gonna attempt to put some perspective on that question, because we are in the middle of a crisis on a crisis, and we work in a system where we have been in a housing crisis and different healthcare crisis for, I don't know, I've been working at this for over a decade, and there's always a crisis. So the agency I work for was founded in 1978, and my job is to work with whoever is in whatever position at the local, state, and federal level. That doesn't mean we get the same type of support. That doesn't mean we have the same type of relationship with everyone. And it is our duty, it is our responsibility to call out that racism when we see it. And sometimes that is actually harder on the very local level than on the federal level. So with that, wash your hands, wear your mask, vote in November, and take a good, long, hard look at your own systems. The reason I put up those rapid rehousing systems is kind of the flip side of what Sean was just talking about. What decisions are we making that screen people in and out? And those decisions we have complete control over. We can change them. So if we find that they aren't equitable, we change how we do it. So I think I'll just leave it there, and that is not necessarily a satisfactory answer to solving all of the world's problems, but some days you got to solve the problem right in front of you first and keep working on those bigger issues.
And I will say
Thank
this.
you very much.
Let me say too, Cindy, let me say this right quick too. So I recall when we were talking about some of the racial equity network, and then Dawn, you were at some of the NAEH meetings. I couldn't even say my own organization. That's age for you. But at any rate, though, because a lot of times we do work with a lot of groups are way advanced in their work, and of course we in a larger context, there's a host of reading that people recommend, understanding whiteness, that type of thing. And I will say, Dawn, one thing that I remember about you that I always appreciate at the beginning of the conversation is that you would say, that's good, but the recognition of really having that difficult conversation about racism and that people actually get, I understand in this room, but the reality, and as a Black woman, that resonated, because that's what I often say, the reality of people really understanding that, I think, and that's why I wanted to open and give some background. Now some people, not everyone, they're starting to say, okay, maybe things are unjust, and maybe structural racism is real. And so I don't necessarily like to put it on any party, any administration. It's been a problem. It is a problem. And we have a lot of work to go. And like I said, it's not going to be a fad. It's not going to be a conversation today. And so we got to be committed to action and doing, regardless of who's there, because this has been a problem. And it goes across party areas. Just because I'm in the East Coast, on the East Coast, doesn't mean everybody on the East Coast or people in California, they all get it. No, this is a problem across the nation, across parties, across administrations.
And I will just, one more add on that. That is also the reason I put up the slide that I think ties up housing, healthcare, and policy decisions. And that's looking at a map from the 30s next to a map from 2020 and policy decisions and how they affect us today. And quite frankly, in Jacksonville, Florida, one of the lead headlines locally today was that City Council is finally committing sort of to invest in those neighborhoods that they made promises to when our county consolidated in 1968, which I can tell you is 52 years ago. So those promises were made the year that I was born and have yet to be delivered on. So there, like Sean said, it didn't just start. It isn't because of the pandemic, but I think there's lots of things that are colliding together that just are crystallizing. Number one, if there's a safer at home order and you don't have a home, what happens to you? In the midst of a healthcare crisis, if you know that there are huge disparities in healthcare for groups of our neighbors, what's our responsibility for that? So I really commend you all for being here and listening and learning, because we all have work to do across this country.
Thank you both so much. The next question is similar in the sense that it refers to the current administration, but it is a specific policy that they're asking about. And this is the recent decision to bar federal government agencies and contractors from providing training on race theory and white privilege. And how do you think those kinds of policies are going to impact health equity, but also just the experience of veterans that are of color who are experiencing homelessness?
So Changing Homelessness is not a contractor, we're a grantee. So we are still waiting clarification on that. But I will also say words matter. And the data doesn't care, right? Like the data isn't telling us anything other than this is what is actually in front of us right now. I think there are ways to still present what is really happening, really on the ground, and ways for us to continue, like I said, moving that needle forward. I don't agree with that. I think it is critical in the work that we do with veterans and other folks who are experiencing homelessness is we have to understand where they're coming from on all sorts of different levels, not just race and ethnicity, but also what sort of trauma have they experienced, just their life. And I think not looking at it from that lens can make it the work more difficult.
And let me say, just in more simplistic terms, is that you hurt people, and that's the bottom line. Because the fact of the matter, and I'll use the example again from the particular and the COC that we use to test the tool. Well, without looking at their data, without delving into racial equity, they had no idea that only 20% of Black people were getting in transitional houses because they didn't look at it that way. Now, me, hey, I'm a policy person. based out of Washington. We don't do any services. But at the end of the day, you hurt people. Now, so I have never been a person experiencing homelessness, but I've been Black my whole life, and I know what racism feels like. I know what discrimination feels like. I know how it has set people back. I can honestly tell you how my grandmother, and I'm not saying that she had to go to, I'm very proud that my grandmother is a graduate of an HBCU, but I could tell you about her 4.0. I don't even know if that really was, but she had all straight A's. I don't know how they ranked it back then, but I can tell you some white schools that she didn't get into, and I can tell you why you hurt people. So if that doesn't resonate with you, and you're in a field that you supposedly care for people, and you are dedicated to serving people, I don't know what else to say, but that's the bottom line. You hurt people, and people are set back, and that's why we see all of these systemic disparities.
So I think, and this question is probably primarily to Sean first, but Dawn, your perspective is valued in a different way. But the question comes back to, and I know, Sean, you mentioned this is a hard day for you and for many people of color today. What do you do when you feel overwhelmed and fatigued by all of the setbacks, bad things that are happening, injustice? I could use all different kinds of words here, but what advice do you have for folks who are feeling overwhelmed, either because they are a person of color and this is a personal experience for them, or they are not? They're a white person who is in this system trying to make change, but they also feel overwhelmed. And what suggestions or advice do you guys have for them?
Mm-hmm. So, of course, I would say you have to take care of yourself. But let me say what inspires me. I look back, like I mentioned, my grandmother and where she went, what she struggled with. You think of someone like a giant like John Lewis, who recently died, but he sat at a lunch counter. He let people call him nigger. He let people hit him. He let people beat him. And those were things done. And even people always mention Martin Luther King, but Martin Luther King knew that he would probably be assassinated given the times and given the threat. He didn't do that for himself. He did that for me. And so I can't get tired because I've had too many giants. Fannie Lou Hamer. We talk about right now there are reports that some of the folks in the detention centers, some of the women were given hysterectomies. What do you think happened to Fannie Lou Hamer? But yet she kept fighting for me, for us, for this country, for the future. So anytime I get tired, I think of the leaders, and there were white leaders too. And actually, I can't think of the pastor's name. He actually just died yesterday or 2 days ago. Who supported the college movement and the bus movement across. So you think about people who lost their jobs, people who lost their life, and they give me breath. And at the same time, I have a 6-year-old, so you have to be. I'm chasing her all day. But I talk to people that are good, who I can trust, and who uplift me, in addition to looking back and knowing where I came from and understanding the history and the people who fought for me and the advantage that I have. And I hope, which gives me motivation, that I represent them as well as they represented me.
So I am not a person of color, and I'm still feeling a bit overwhelmed, right? So I can't even imagine what that extra layer is. So for everybody out there, we are 6 months into a pandemic. And as so what I am doing, right? Feel free to admit sometimes you hit a wall. Someone put up something that it was from a doctor from Doctors Without Borders, who talked about, this is my first pandemic, but I've gone into crisis situations before, and the wall at 6 months is real. And so at 6 months, some days it is okay to do what you need to do, right? Like, we got to get up, we got to go to work, we got to take care of our kids. And the creativity will come back. The energy will come back. the enthusiasm will come back that you had at the beginning. But it's okay to acknowledge when you're staring at the wall. With that, not only take care of yourself, but take care of your friends. I would encourage you, pull out your phone, send a text to someone that just says, "Happy Thursday, how are you doing?" Right? We all have a few friends that are going through struggles that are compounded by all of this. You know who they are. Make sure they're all right. Sometimes it means more than you will ever know that you reached out at the right time. So with that, take a long walk if the weather's nice. Do what you enjoy, and give yourself a little space to keep working through all of this, because it is a lot. It is a lot that we are dealing with personally, professionally, and as the questions have come in on a national and international level.
Thank you both so much. We've gotten a couple of comments of people thanking you both for your passion and your commitment. And the pastor's name, we actually had somebody submitted it. It's Robert Grates is the pastor. I think I'm pronouncing that right. We have another question, which is, do either of you know if HUD-VASH has ever tracked who gets a voucher and who gets placed in HUD-VASH housing by race? If that information has been has tracked, and if you don't know, we can certainly follow up on our end. And there may be other programs that people are interested in as well. But
I'm pretty sure they track it. I don't know if I've ever seen it public as far on a national level. Depending on how close they're tied into coordinated entry, you can kind of see who gets referred into it. But I would guess there are going to be disparities, probably more disparities on the HUD-VASH than on the SSVF side, only because there's higher requirements. And we see in any program when there's like longer length of service, honorable discharge versus an other than honorable, it tends to skew it in that way again.
Thank you. So we just have about 2 minutes left. So I wanted to give each of you a chance to just give a parting thought. We almost did that a second ago, I think, but I feel like just to give one, if you were going to give one piece of advice to folks listening, or just one thing about what they can do in this push to really bring the conversation about racial equity into our daily work. And I guess, Dawn, I'll start with you since Sean went first before, and I'll give Sean the last word.
All right. This question, along with the work we do, you are not in a sprint, you are in a marathon. Refresh yourself, pace yourself, and keep going, because that is when we start to see changes happening. As mentioned in my bio, I mean, when we do look backs, we're doing a 10-year look back, because it matters that we can make the change and then sustain it. So thank you all for hanging with us to the end.
And I would just say, because a lot of these things I talked about, I want to acknowledge people and understand that everybody on the call and people who contact me, they aren't necessarily in the power positions at work. And, we haven't necessarily talked about the organizational stuff. And so, it's no secret that, the homelessness system largely, in terms of the leadership, is largely white, right? And so getting to that point where you have the comfort, where you have the support, so it isn't easy. So I just want to acknowledge that and appreciate the people who are on the call, willingness to have this discussion. And I would just encourage you to, if you are in that position at work, to build support within, if possible, and to keep navigating, build your coalition to keep navigating until you can reach the top. Because at the end of the day, we do serve people. And obviously, we want our systems to be equitable. So I appreciate that you attended this discussion. Whether you have the power or not but I hope this at least gave you some type of inspiration or some type of, even if it's a minuscule piece of thought, strategy-wise, to help you get started. And I hope you can get that support and recognizing that you might not have it.
Thank you, Dawn. Thank you, Sean. And just so you both know, there are quite a few comments in saying that this was a very inspiring presentation. So thank you both for taking the time today and for all the work that you do. We really appreciate you as well, and hope that this is my text to you saying I hope you two are both okay as well. And we appreciate you. Thank you all very much, and enjoy the rest of your Thursday. And for some of you, we'll see you back Friday for the last day of our conference. Thank you so much, everybody.
Bye, everyone.
Bye.